All right, so get ready because today we're diving deep into the world of hospice care.
Ooh, hospice care.
Yeah, it's a field that people, I think, have a lot of misconceptions about, but it's super important work.
Yeah, for sure.
And whether you're thinking about maybe becoming a hospice nurse or you're just kind of curious about what it's all about, get ready to have some assumptions challenged.
I like it.
So we're going to be going deep into a set of 20 common interview questions and answers that you might get if you are applying to be a hospice nurse.
Okay.
But here's the thing, we're not giving career advice. We're using these questions as a way to understand, like, the core of what hospice care is all about.
Oh, I love that approach.
Yeah.
Like we're reverse engineering the ideal hospice nurse,
Yeah.
right?
Yeah.
What are the qualities that you absolutely need to thrive in that kind of environment?
Yeah. And, it's not just about, like, knowing the medical stuff. We're
Right.
talking about how do you have really tough conversations with people? How do you understand all the different ways that people view death and dying, culturally?
Yeah.
And how do you balance, like, medical expertise with being emotionally intelligent?
Oh, for sure. You're right on. It takes a special blend of skills, that's for sure.
Yeah.
And I think at the heart of it, it's recognizing that when a cure isn't possible,
Right.
comfort becomes the priority.
Absolutely. Yeah.
Yeah.
So let's look at some specifics here.
Okay.
One of the questions that I thought was really interesting was, how do you assess pain in a patient who can't actually tell you verbally that they're in pain?
Yeah, that's like detective work.
It is, right.
Absolutely. Yeah, you got to think about nonverbal cues like their facial expressions. Are they grimacing? Are there changes in their breathing?
Oh, wow.
Is there muscle tension? Are they really stiff? Are they
Right.
guarding? Nurses actually use specific scales to kind of help interpret these signs. Like there's something called the pain aid scale,
Oh,
which
boy.
is specifically designed for patients with advanced dementia. So it's really another level of observation and empathy that's required there.
Yeah, it's intense.
Hmm.
And speaking of empathy,
Uh,
another question that came up was, how would you explain a terminal diagnosis to a family?
Ooh, that's a tough one.
It's tough, right? And it's something that nobody wants to do, but it's part of the reality of hospice care.
It is, yeah. And the source material that we were looking at, it emphasizes the importance of honesty,
Mm-hmm.
but delivered with compassion, right? It's not just about delivering the news, but it's about providing resources, answering questions, and offering emotional support during what is just an incredibly raw and difficult moment for families.
Yeah, and it makes me think about anytime we have to have a tough conversation in life, whether it's about health
Right.
or just like personal challenges or whatever,
Absolutely.
those skills of being able to deliver hard news but in a kind way
Hmm.
are so important.
So important, yeah.
So let's talk about the elephant in the room, I guess you could say, which is what happens when a patient's wishes about their end-of-life care are totally different from what their family wants.
Oof. Yeah, that's a complex ethical dilemma.
It is.
And the source material provides a really helpful framework for navigating that.
Okay.
So first and foremost, understanding the perspectives of both the patient and the family,
Mm-hmm.
like really taking the time to listen and understand where they're coming from,
Right.
and then respecting the patient's autonomy, even if it differs from the family's wishes.
Right.
So the patient's voice, the patient's desires, their wishes, those need to be prioritized.
Right.
And then finally, working to find a compromise that honors both the patient's wishes and addresses the family's concerns.
Right. So it's like this balancing act.
It is, yeah.
And it makes me think, how much weight should a patient's wishes have if maybe they're not fully capable of making decisions anymore?
That's the real question, isn't it?
Yeah, it's heavy.
Yeah, and it's something to think about even outside of healthcare. Like we all have loved ones who might face these situations someday.
Absolutely.
And this is where having those advanced directives like a living will becomes so important.
Right.
Because they really provide a roadmap for decision making when the patient themselves may not be able to express their wishes directly.
I see. That makes sense.
Yeah.
Okay, so we've talked about communication, like the importance of clear communication.
Mm-hmm.
We've talked about ethical considerations.
Yeah.
So let's switch gears a little bit and talk about cultural sensitivity.
Okay.
One of the interview questions was about, how do you, as a hospice nurse, handle cultural differences in end-of-life beliefs?
That's crucial.
Yeah.
And it's not just about being respectful, it's about actually understanding that different cultures have unique rituals and family dynamics.
Right.
And even views on pain management. For
Mm.
example, some cultures might favor a more stoic approach to pain, while others are more open to medication.
Right. So it's like you're not just communicating with words, you're communicating with cultural understanding too.
Exactly. You're reading between the lines.
Yeah.
You're paying attention to those nonverbal cues.
Yeah.
And really, the key is to approach each patient and family with humility and a willingness to learn, ask questions, be observant, and, understand that there's no one-size-fits-all approach.
That's so true.
Yeah.
And it makes me think about how important cultural awareness is just in life.
Absolutely. In every aspect.
Yeah.
Yeah. It's about recognizing and respecting the diversity of human experience. It's huge.
Yeah.
Yeah.
Okay, so let's move on to another aspect of hospice care, which is teamwork, right? It's not a solo mission.
Oh, no, it takes a village, right?
Yeah, absolutely.
A whole team.
A whole team of dedicated professionals all working together. So one of the questions is, what qualities are essential for a successful hospice team?
Yeah, and it highlights the need for open communication, trust, empathy, and being able to handle conflict constructively.
Oh, interesting.
Yeah, it's about creating that supportive environment where everybody feels heard and valued.
Right.
Not just the patients and families, but the care team as well.
Yeah, it's like a whole ecosystem.
It is, because you got to face it, working in hospice can be really emotionally challenging.
Oh, I'm sure.
Yeah, so having a strong, cohesive team is essential not only to provide that compassionate care, but also to support each other through those really tough times.
Absolutely. And it makes me think about all the teams I've been part of, both personally and professionally, like what made them successful. Was it that open communication? Was it a shared sense of purpose? Was it like, a willingness to support each other no matter what?
Absolutely. All those things for sure. And it's really interesting as we keep looking at these questions, it becomes so clear that hospice care is about so much more than just medical expertise.
Right.
It's about being there for people at one of the most vulnerable times in their lives.
Absolutely. And how do you even begin to measure that? Like just being a compassionate presence.
Yeah, it's immeasurable.
Someone going through that.
Yeah. And I think that's a skill that's often overlooked in healthcare. Think about a time when you were going through something really difficult in your own life.
Yeah.
What did you need most from the people around you?
Support.
Was it a listening ear?
Yeah.
A shoulder to cry on? Someone to just acknowledge your pain?
For sure. Yeah. When I think about the times that I've lost loved ones, it's not always like the big gestures that matter. It's the little things, like the quiet moments.
Totally.
Like just being there.
That shared grief.
Yeah.
Yeah. And that's what hospice nurses do on a daily basis. They provide that steady presence.
Yeah.
That unwavering support, even when words fail.
Yeah. Which makes me think about one of the other interview questions that we saw.
Okay.
Which was about offering emotional support to a family who's grieving. What stood out to you about that one?
Well, I think it really highlighted the importance of empathy,
Okay.
active listening, and recognizing that grief is a unique and personal journey for everybody.
Right.
There's no right way or wrong way to grieve.
Right.
And a hospice nurse's role is to meet that family wherever they're at in that process and provide support without judgment.
Yeah. I noticed that the source material talked about offering words of encouragement, connecting families with resources and stuff like that.
Yeah.
But it also talked about just being there.
Yeah, just being present.
Being present.
And that can be incredibly powerful. Sometimes the best thing you can do is just sit with someone in their pain, acknowledge their loss, and just let them know that they're not alone.
For sure.
Yeah.
Okay, let's talk about some of the ethical dilemmas that come up in hospice care.
Okay.
So one of the questions is, how do you handle it when a patient's wishes conflict with what their family thinks is best?
Oh, that's a tough one.
It is, and it makes me think about advanced directives.
Yes, absolutely.
Living wills and stuff.
Living wills, durable power of attorney for healthcare.
Yeah.
All of those documents become so crucial in those moments.
Right, because they provide a framework.
They do.
If the patient can't speak for themselves.
Exactly. Yeah. So it's about advocating for the patient's autonomy, even if it goes against what their loved ones might prefer.
Yeah.
And sometimes that means having really difficult conversations with the family, explaining the patient's wishes, helping them understand the legal and ethical implications of going against those wishes.
Gosh, I imagine those are some of the hardest conversations you have to have.
They are. And it's important to remember that emotions are running high in those situations.
Oh, yeah.
Families are grappling with fear. They're grappling with grief. They're grappling with a sense of helplessness.
Yeah.
So as a hospice nurse, you have to approach those conversations with just so much empathy and compassion.
Right.
While also upholding the patient's right to make their own choices.
Right. Self-determination.
Self-determination, exactly.
Wow. It makes you realize that hospice care isn't just about the patient themselves.
It's not.
It's about caring for the whole family.
It's about the whole family unit.
Wow.
And that support can take so many different forms, you know. It might be providing emotional support. It might be connecting the family with resources. It might be just being there as a steady presence as they navigate this uncharted territory.
Yeah. And speaking of uncharted territory,
Yeah.
one of the questions talks about working with a patient who wants to die at home, but they don't have the resources or support to do so.
Oh, yeah, that's a tough one.
Heartbreaking.
It can be really heartbreaking, and it highlights the disparities in access to quality end-of-life care.
Yeah.
So a hospice nurse's role in those situations is to advocate for that patient's wishes as much as possible.
Okay.
Explore every available option and get creative in finding solutions.
So you're like a resource connector.
You're a problem solver.
Mm.
You're a fierce advocate for that patient's right to die with dignity.
Yeah.
Regardless of their circumstance.
Regardless of their situation.
Right. And that might mean connecting the family with community resources. It might mean coordinating care with different healthcare providers.
Right.
It might even mean arranging for volunteer support to come in and help out.
So it's like you're putting together a puzzle.
It is, yeah.
To try to figure out how to give them what they want.
Exactly. And it takes a deep understanding of the resources that are available.
Right.
Strong communication skills.
Yeah.
And just a relentless commitment to that patient's well-being.
Yeah.
Yeah.
Another question that really kind of shows all the different things that a hospice nurse has to do is coordinating care between different providers.
Oh, yeah. That can be a logistical nightmare.
It's a lot, right?
It can be.
Because you're dealing with all these different people.
Yeah. Hospice patients often have very complex medical needs.
Right.
So ensuring that the doctors, the nurses, the therapists, the home health aides, that everybody is on the same page.
Yeah.
Communicating effectively.
It's like you're the conductor of an orchestra.
You are. You got to make sure everybody is playing their part in harmony.
That's a good analogy.
Yeah.
Okay, let's talk about the emotional side of things.
Okay.
You know, facing a terminal illness, it's an emotional roller coaster. And there was a question about how do hospice nurses help patients to cope with all the feelings that come up?
Yeah.
The fear, the anxiety, the sadness.
Yeah. Those are all incredibly common emotions for people facing the end of life.
Right.
And it's crucial that hospice nurses address those needs just as much as they address any physical symptoms.
Totally, yeah. The source material mentioned things like cognitive behavioral therapy,
Yeah.
music therapy, art therapy.
Right. And it's all about finding what works best for each individual patient.
Right. Different things for different people.
Yeah. Some patients might find comfort in talking about their fears, while others might prefer to express themselves through art or music.
Sure.
So it's really about meeting them where they are and tailoring the support to their individual needs and preferences.
Yeah.
And sometimes it's as simple as just being present,
Right.
listening without judgment,
Yeah.
and offering that compassionate presence.
What about when a patient refuses to take their medication?
Oh, yeah, that's a common challenge in hospice care.
Is it?
Yeah.
That must be tough.
It can be, and the source material emphasizes the importance of really understanding the patient's reasoning.
Okay.
You know, not just assuming that they're being difficult,
Right.
but really digging deeper and finding out why they're resisting treatment.
So asking questions.
Asking questions.
Really listening to the answer.
Listening without judgment.
Yeah.
And trying to see the situation from their perspective. You know, maybe they're experiencing side effects from the medication.
Oh.
Maybe they're afraid of becoming dependent on it. Maybe they feel like they've lost control over their own body.
Right. So it's about respecting their autonomy, even when it's hard.
Even when it's difficult. And it might mean finding creative solutions or compromises.
Right.
It might mean adjusting the medication dosage. It might mean exploring alternative therapies.
Right.
Or it might just mean offering reassurance and support as they go through this.
Yes. Make them feel heard.
Exactly. Now, not all hospice patients are adults.
That's right.
There's a question about experience working with children and adolescents in hospice care.
That's a highly specialized area of hospice care.
Yeah, it must be.
That requires a really deep understanding of child development
Okay.
and the unique challenges that those young patients and their families face.
And the source material talks about helping children to cope with their situation
Yeah.
and providing support to their families. What does that actually look like, though?
Well, it might involve using age-appropriate language to explain what's happening.
It might involve incorporating play therapy techniques,
Oh, wow.
creating a really comfortable and supportive environment for the child,
Yeah.
and working really closely with child life specialists.
I think
So, yeah, it requires a lot of creativity and sensitivity,
of it.
but it also demands a tremendous amount of compassion and resilience because working with children and adolescents in hospice care can be incredibly rewarding,
Yeah.
but it's also emotionally very demanding.
Yeah. Heavy stuff.
Yeah,
So we've covered a lot here.
we have.
And I'm starting to see a theme. Like, it's not just about the medical knowledge.
It's not.
It's about being an advocate, being a counselor, a problem solver, and just a good human.
You've hit the nail on the head.
Yeah.
Hospice care is about so much more than just treating a disease.
Yeah.
It's about caring for the whole person, their physical, emotional, and spiritual needs,
Yeah.
as well as supporting their loved ones through an incredibly difficult journey.
Yeah, it's about recognizing that every human life has dignity. No matter what, no matter how old they are, what their circumstances are,
Exactly.
and making sure that that final chapter of their life is as peaceful and as comfortable as possible.
And meaningful as possible.
Yeah.
Yeah, absolutely.
You know, as we wrap up our deep dive into this whole world of hospice care, I'm really struck by just how much these interview questions tell us about what this profession is really all about.
Yeah.
It's so clear that hospice nurses, they're not just like medical professionals, right?
There's so much more.
They're guides, they're advocates, they're like these sources of comfort for people who are going through like maybe the biggest challenge they'll ever face.
For sure. And one of the questions that I thought was really interesting was the one about how hospice nurses handle cultural differences when it comes to beliefs about death and dying.
Yeah, that one's super important.
It is, and it recognizes that, death and dying, these are deeply personal experiences, and that they're often shaped by cultural traditions, spiritual beliefs, family dynamics, all of that.
Yeah, and the source material gives like a pretty general answer.
It does.
But I'd love to hear your take on it.
Sure.
Like, what are some actual examples of how you have to be culturally sensitive in hospice care?
Well, imagine a family who culturally, it's taboo to talk about death.
Oh, wow.
Like they just don't do it right.
Yeah.
And so as a hospice nurse, you have to be sensitive to that belief,
Right.
while also making sure that the patient has all the info they need to make their own choices.
Right.
Or think about a culture where traditionally family members take care of their dying loved ones at home. So a hospice nurse might need to kind of adapt their approach to support both the patient and the family
Right.
in a way that honors those traditions.
So it's really about understanding that there's no one right way to approach end-of-life care.
Exactly. You got to be adaptable, respectful, and willing to learn from each patient and family.
Yeah.
And it's as simple as asking questions like,
What are your beliefs about death and dying?
right.
Are there any particular rituals that are important to you and your family?
Yeah, just being curious
Yeah,
and open
exactly.
makes me think about how important cultural awareness is in life, period.
Totally, in every aspect.
Not just in healthcare.
Absolutely. Whether we're talking about healthcare or education or just interacting with our neighbors, like understanding and respecting different perspectives.
Yeah,
That's crucial for building any kind of meaningful connection.
absolutely.
Yeah.
So let's switch gears for a minute and talk about, hospice nurses as professionals.
Okay.
There's a question about how they stay up to date
Oh, yeah.
on all the new developments in the field, which makes me think, like, hospice care must be constantly changing.
It is. It's a relatively young field, actually.
Okay.
And there's new research, new technologies, new best practices. They're emerging all the time.
Yeah, for example, there's a lot of interest these days in using virtual reality to help patients manage anxiety and pain.
Really?
Yeah, and there are studies going on right now exploring the benefits of integrating palliative care earlier in the course of a serious illness.
I see.
So it's a really dynamic field.
Wow.
Yeah, and the source material talks about, the traditional ways to stay current, like going to conferences, reading journals, taking continuing education courses.
Yeah.
All of those things are important.
Right.
It's about having that thirst for knowledge, a commitment to lifelong learning. And it's not just about learning new things.
Right.
It's about actually applying what you learn to make things better for your patients.
Absolutely.
Yeah.
Okay, last question.
Okay.
And I think this one is like maybe the most powerful one in the whole set.
Yeah, I know which one you're talking about.
What do you consider the most important aspect of being a hospice nurse?
Oh, that's a good one.
Right, like gets to the heart of it all.
It does. And for me, the answer is pretty simple. It's about providing care with compassion, putting the patient at the center of everything.
Yeah, and the source material kind of echoes that, right?
It does.
Like meeting patients where they're at, listening with empathy, honoring their needs and their wishes.
It's about recognizing that each patient is an individual with their own story, their own fears, their own hopes, their own way of facing this.
Yeah.
It's about walking alongside them on that journey, offering support, offering comfort, and hopefully a sense of peace.
So powerful.
It is. It's about recognizing the dignity in every human life.
Absolutely.
No matter their age, no matter their circumstances, and making sure that that last chapter of their life is filled with as much love and meaning and connection as possible.
Well said.
Yeah.
Well, I think that's a beautiful place to leave it
It is.
as we wrap up this deep dive.
Yeah.
I'm just so grateful for the work that hospice nurses do.
Me too.
They bring so much compassion and expertise and just a deep understanding of what it means to be human to one of life's most challenging experiences.
Couldn't agree more.
So I hope that this conversation has given you a little glimpse into the world of hospice care.
Yeah, me too.
All the complexities, all the rewards, the profound impact that it has.
Absolutely.
And for you listening, we'll leave you with this. If these are the qualities of a great hospice nurse, what does that tell us about the kind of care and compassion that we should all try to bring to our own lives?
That's a great question to ponder.
Yeah. And we'll see you next time.